I'm Bob Bonow. I'm a cardiologist at the Bloom Cardiovascular Institute at Northwestern Medicine. I'm also the Goldberg Distinguished Professor of Cardiology at the Feinberg School of Medicine at Northwestern University, and I'm Editor-in-Chief of JAMA Cardiology. One of the most important roles of the editor-in-chief of any journal, including JAMA Cardiology, is to select the inner core of editors and associate editors, deputy editors to work with us to deal with the constant flow of new information. So immediately I reached out to Clyde Yancy, our chief of cardiology here, because he is a consummate writer, author, and heart failure expert to cover some of the heart failure space. And also Sadiya S, who is a up-and-coming superstar in preventive cardiology, also heart failure. And also selected for kind of our senior role, Donald Lloyd-Jones and Douglas Vaughn, who sit at the kind of the higher tier. They don't deal with the inner comings and goings of our manuscripts on a weekly basis, but they serve as a kind of a senior pool with others to oversee what we're doing, make sure we're doing it well, make sure that our policies are in place. When Clyde agreed to serve as one of our deputy editors at the beginning, I knew I had it made. And that's because Clyde is a very special person, not only a good friend, but also a consummate clinician, really cares about people. And so when we have to deal with topics that are so important these days, social determinants of health, how we deal with issues of race and disparities and equity, Clyde climbs in and really helps us steer some of that gauntlet.
Officially, my role at JAMA Cardiology is to serve as deputy editor, meaning I support the chief editor, which is Bob Bonow. But in practice, my role at JAMA Cardiology is to help promulgate the best clinical science there is in the entire universe of those that practice cardiovascular medicine. I use universe deliberately because it's not just the United States, but it is across the world now. So we have an opportunity to aggregate, curate, and then promulgate the most important clinical science. That's really the role that I embrace the most. When you think of the editor-in-chief of JAMA Cardiology and you recognize it as Bob Bonow, you kind of pause when you say that name because you realize that you're talking about an icon in American medicine. You're talking about one of the few people that perfectly exemplifies what it means to be a physician, an investigator, and a leader. You have to lead by integrity in today's world. You have to be trusted, trustable, trustworthy. Check all the boxes. Bob Bonow is that person. And he's my friend too.